I want to thank all of you for being here today. And thank you for taking the time out of this wonderful Saturday, at least it is here in Buffalo, where you're viewing me from. And just want to talk to you today about stigma and mental health, and talk about the trends that we're seeing. I do need to be able to share my screen. So if someone can help me with that, I'm not able to do that. But I'll just start by saying and talk about the stigma, what it is. So stigma itself is the ability to understand. It's a label. Basically, it means that it's a label of disgrace or shame that people carry with them. Stigma's been around for many, many, many years. And so we know that with stigma, it's been something that has affected people with mental illness all these years. In fact, when you think about it, stigma is something that many of us face in all kinds of ways. So for instance, there's been stigma associated even years ago with cancer. There's been stigma associated with HIV and AIDS, and then certainly addiction and mental health. So when you think about stigma, you might think of words such as crazy or nuts or psycho. Those are words that people use in regular language that, of course, affects people every day. So what I want to do is kind of frame this, and I talk about this presentation being the mental health past, present, and future. So I want to kind of dive in just briefly into the history of mental health treatment and talk about maybe some of the things that you may or may not be aware of. So many, many years ago, we're talking basically 600 years ago, 700 years ago, there was an idea that of course, mental health was more based around demons and physical illness. And the idea was that there was just so little known about mental illness as we know today. So they did use different types of treatments, but they really were very crude and if anything, very damaging to people. I mean, even to the point, as you see here, including creating holes in the patient's skull, which I'm going to touch on a little bit, did happen as of recently in the 20th century. In the 18th century, certainly jails and institutions were used. And as you see, women were treated remarkably different than men. But the thing is that it's interesting is that there was this idea of treating people differently and actually treating people with care and compassion. There were some movements in Europe that did that, and especially in France. So there was a view of individuals living with mental illness that began to kind of change the course of how things were done and how treatment was being provided. And then certainly in the 19th and last century, the 20th century, psychiatric hospitals, and they're called insane asylums, were created. Here in Buffalo, New York, we have the Buffalo Psychiatric Center, and it's been around since the turn of the 20th century. And if you saw it, you would certainly say, yeah, that's what it looks like. I mean, if you look from the outside, it's not occupied now, but it looks like there was like cages on the windows, and it's very kind of scary to look at. But that's where it was at the time. It housed thousands of people. Certainly, Sigmund Freud was the first people to use these things called talking cures. Of course, now we call them psychotherapy, but there are a lot of therapeutic techniques that came out of that, and a lot of people that followed the Freudian line of therapy. Electroshock therapy, electroconvulsive therapy is something also that was used. And then we moved into antipsychotic drugs and other medications to treat mental health conditions. But as you see here, lobotomy and other forms of psychosurgery were happening through, I'd say, the early 50s, which is once again scary because lobotomy is where they really do go into the skull and they try to make a type of surgery to help someone or to try to help someone's mental health. But of course, we know once again that treatment is really archaic and well overdone. So what I want to do though is kind of put things in context. So you've heard about all these treatments, and certainly we know about people living with mental health conditions all over the world, all over the country. In fact, this Monday is World Mental Health Day. We recognize that day to celebrate mental health. And I have my own personal perspective with this topic. I'm a person in long-term recovery from addiction, but I also had my first bipolar manic episode, psychotic episode in 1980 when I was a college freshman. And that really changed the course of my life. Over basically 7 or 8 years, I cycled in and out of hospitals and really struggled with getting a grasp on my own well-being, my emotional well-being, my mental health. And I was really, struggling with also with drug addiction. And even though I was in treatment, I wasn't compliant. I wasn't following my treatment plan, which thereby resulted in me going in and out of these hospitals, like I said. It wasn't until 1988 when I had a session with my therapist, who basically gave me the choices of going to rehab, going to a 12-step meeting, or going back into the hospital, that I realized that I needed to make a change. And I went to the 12-step program. In fact, I went my first day of visiting the meeting was January 15th, 1988. And that was the day that truly changed my life forever. And I haven't looked back since. I've been abstinent, clean from drugs and alcohol since then. I've learned a lot over those years. Of course, it's been nearly 35 years, and it's just been a journey. And of course, mental health is different for everyone. We all have mental health, and it's a spectrum where it goes from well to unwell, and we all fall somewhere on that spectrum. On the far extreme of unwell, I mean, there are people, and we're going to learn a little bit about different disorders in a second here, but there are people who have extreme mental health disorders that certainly deal with these things on a regular basis that make their lives really difficult. Daily activities, work, and so forth are really hampered, and if anything, difficult to deal with for individuals with these severe illnesses. So for me, it's been a journey, like I said, and I've learned a lot. I do work in the mental health field now, and I've been able to take what at one time was a significant challenge for me and turn to something that has been very positive, and I'm able to hopefully help a few people. So currently we have a number of therapies. And of course, when you talk about psychotherapy, these are the talk therapies that I referred to before. And there are a number of them. I'm going to highlight just a few, but these are the ones that are probably most prevalent in our psychotherapeutic world that we know of today. So cognitive behavioral therapy, CBT, is one of the most commonly used types of therapies. As you see, it's able to address things like anxiety disorders, mood disorders, including depression and bipolar disorder, eating disorders, schizophrenia, trauma-related disorders. So really, we're talking about the idea of one's core beliefs and changing negative thinking patterns, eliminating negative behaviors. So when a person goes into therapy and the therapist is using cognitive behavioral therapy, through a number of means, the therapist helps that individual address what those thought patterns are to help them to change their lives for the better. Sometimes there's work that's assigned that's outside of the session that the person does, but a lot of it really comes down to looking at how we think. And of course, think about it yourself. We all have our thoughts. And sometimes you might have a day where you're really down on yourself. You really think negatively about something. Well, imagine if that's happening all the time or a lot regarding, say your mental health, or like you see, or even eating disorders or whatever. That can really be a significant impact. So with CBT, we're able to address these things in a way that is very safe, and it's also evidence-based. And what we mean by evidence-based is it's been tested through a number of populations, and it's proven to be reliable and valid and viable for all kinds of folks. So CBT is probably one of the most common. Then we have dialectical behavioral therapy, which you see here is really more specific for borderline personality disorder. And, of course, borderline personality disorder is what we call an axis 2 personality disorder. So it's not in the same category as anxiety or depression or other mood disorders, but it's very behavioral in nature. And so, but it also has to do with emotions and being mindful and accepting uncomfortable thoughts and feelings. That's what it addresses. So really, when you think about it, the person is in a state where they may have done things like, say, working between individuals, and then we call it like splitting or being manipulative. There's also can be self-injury involved with borderline personality disorder. So DBT, otherwise known as dialectical behavioral therapy, addresses this in a way that's been very, very successful. A lot of it is about mindful practices that's taught in these types of therapies. And then when it comes to post-traumatic stress disorder, PTSD is certainly something that I think many people, and for certain, many of you in the audience, have heard of, but PTSD can affect anyone that has gone through a traumatic or life-changing experience. So in other words, it could be anything from being the victim of a crime, witnessing a crime. It could be, basically growing up in a home that has either substance use or have a parent that's incarcerated. It could be even a natural weather event. Look at what we just went through last week with Hurricane Ian. That whole experience has severely traumatized potentially an entire state and a number of states, all of the eastern seaboard. So trauma is significant. So when we talk about treating trauma, one of the most recent forms of trauma treatments come about is called eye movement desensitization and reprocessing therapy, otherwise known as EMDR. Of course, EMDR is a lot easier to say. But basically, EMDR is very interesting. So even in my own recovery journey, I still see a therapist. And I'm, of course, always working through issues. I think as long as we live, there's always going to be something to work on, which is the value of therapy that I've found. And so I've actually kind of been to explore EMDR myself. And it's just a couple weeks ago, I had an EMDR session with my therapist. And what she did was she provided these, they're called paddles. And I hold onto these paddles, and they provided alternating currents, pulsing action. So what it did was it was a way of making me have an eye movement from left to right, and thereby gave me the opportunity to recall a traumatic event, but in a safe environment and in a safe way. So really the whole point behind the EMDR is to allow the individual to process their therapy and allow them to even re-experience it in the sense that they're able to observe maybe what's happened, but also work through it. And so EMDR has become much more common, although it does take a specific type of therapist who's trained in this type of treatment to be able to provide that therapy. Exposure therapy is another type of therapy for people, as you see here, many times with OCD, PTSD, or phobias. And here we try to expose a person to something that might trigger, say, their anxiety. And of course, if you know anyone who has obsessive compulsive disorder, there may be ritualistic behaviors, there may be things like cleaning or checking or washing, or even with phobias, fears of certain things. So with phobias, it could be, say, fear of dogs. I'll just use that as a simple example. So to use exposure therapy, the person would be, in a sense, exposed to, say, a dog, but through a series of introductions. In other words, you don't just throw a person into a room with the dog and shut the door and run away. It's done through, I guess you could say, a number of sessions, a number of exposures, and then work the person into being able to handle whatever the phobia is. So basically, but it's a controlled environment, as you see here. So really, it's meant to do that in a way that's very safe, so that the person isn't triggered and thereby having one kind of episode or another related to it. And many times people who have phobias will develop anxiety disorders and also have anxiety attacks or panic attacks. And then we have animal-assisted therapy. This is something that I really can appreciate. So basically, there are trained therapy dogs and animals that work with individuals that might have things like you see here, anxiety, PTSD, even physical diseases like cancer and heart disease. But basically, the animal, whatever it is something that naturally reduces people's anxiety or can even lift them out of depression. I mean, imagine, when you go on Facebook and you see all those wonderful puppy videos or cat videos on YouTube, it makes you feel good. And imagine being with a pet and being able to pet the dog or pet the cat. And it's very soothing. I have a dog myself named Sophie, and I know when I'm with her and I'm petting her fur, it is just very soothing. And so dogs, when trained properly, can be great when helping individuals that are struggling with their mental health, to be able to give them a way to work through things. And it's just an adjunct, I would say, to traditional treatments, and not maybe the only type of therapy that's out there, but it certainly can help. There's even equine therapy with horses that people have done. So there's all kinds of therapy animals out there that have recently become very valuable. Now, of course, we know there's service animals. Of course, you might see someone in a store or even on a plane with a service animal. That's not quite the same thing. Service animals are really more for an individual. They're trained with the individual. So even though there obviously is a therapeutic effect, it isn't the same thing as animal-assisted therapy. There's a little bit of a difference there. And then we have family therapy, which of course is family. So many times we are using these things for substance disorders, eating disorders, behavioral problems, anxiety, OCD, and medical issues. A lot of times this has to do with individuals in adolescence. Certainly with family therapy, many times there might be a youth, a child or adolescent involved, that there might be a core issue that needs to be worked through. So the entire family is there together, including if there's multiple children, even the children that may not be dealing with, say, a specific concern, but they are, of course, in the family dynamic, the family system. So it's important that they're part of that too, because obviously they're affected just like everybody else. So in a family therapy setting, it's basically facilitated by a therapist, and the therapist, like in any therapeutic setting, whether it be family or any kind of that I just mentioned, the therapist is really more of an objective, non-judgmental individual who is able to provide feedback in a way that is supportive and essentially not telling people what they need to do, but really more guiding them in discovering what works best for them. So really every family and every individual in therapy is very different, but that's why it takes a skilled practitioner to help folks. So certainly we have practitioners and therapists all over the country that do these things. They're specialties that they have. So certainly some therapists will work in certain modalities better than others. There's some therapists that do work specifically with families, that their specialty, or couples therapy, which is another type of therapy. So there's all kinds of therapists that can help in all kinds of situations. And so the group therapy is something that is very common. It's been around for a long time. I've worked clinically in the past as a counselor. So I've used group therapy many times. I know exactly what it's like to work with a group of individuals, and essentially they have similar issues. So in my case, I worked in a behavioral health setting, but I work with people dealing with addiction. So that was a common thread. That was a common theme that we would always focus on in these group sessions. And essentially what happens is that you will be able to kind of get a sense of the group and help the group to help each other. The great thing about group therapy is that when you have someone who, say, is understanding what's going on and maybe kind of getting the whole idea of what they need to do, others in the group can learn from that. So it is possible to have an individual in a group therapy setting who's setting a very strong example, and others can follow. On the other hand, in group therapy, there can be times when you have an individual who takes things off topic or is maybe obstructive in nature or defiant. That's where a skilled therapist has to come in and kind of help them, redirect them rather, to what's going on and be able to address what that individual is doing, so they don't basically hijack the session and really make it not worthwhile for anyone. But group therapy is very effective, and like you see here, it leads to discussion. Therapist leads the discussion, and a lot of times it is about sharing personal thoughts and experiences. And like you see here, it also helps individuals realize they're not alone. When it comes to mental health conditions, many people feel like they're the only person in the world that's dealing with things that's exactly the way they are. I'll tell you, from my experience as someone who lives with a mental health condition and also in long-term recovery from addiction, as well as individuals who, in my group professional work, people are dealing with all kinds of things. There's nothing new under the sun. So the group session really helps by being able to help people realize that they're not the only one, and it can help. So group therapy, as you see here, helps with youth, depression, anxiety, addiction, trauma, personality disorders. Basically, group therapy is used for all different types of mental health conditions because of the value of group. I mean, there's a whole basically curricula written around group therapy and what clinicians learn to be effective. I do want to mention one thing here briefly about something that is really come up in the behavioral health world very much, I'd say, over the last, especially the last 10 years. It's been around for a little bit, it's been around longer than that, but in the last 10 years, this idea of trauma-informed care has really risen to be something that a lot of not only behavioral health organizations, but a lot of organizations in general are starting to embrace. So when you think about trauma, we ask the question, what's happened to you, not what's wrong with you. So originally, if you think of someone who's dealing with a mental health condition years ago, it used to always be the like, what's wrong with you? What's your problem? I mean, trying to look at it that way. Whereas now we realize that most mental health and addiction related conditions are related to trauma. So the root of the illness, which is essentially the symptom, whether it be the addiction or the mental health condition, is rooted in trauma. I heard a statistic that about 80% of all mental health and addiction concerns are related to trauma at some one time or another in a person's life, and especially early childhood trauma, which is something that we've learned about through a study called the Adverse Childhood Experiences Study, otherwise known as ACEs. And ACEs, the ACEs study was originally developed right around the early 1980s through the Kaiser Permanente hospital system in California. And they were basically trying to develop a method and a tool to help people who were living with obesity, who were dealing with obesity. But what they discovered through the research was there were some common themes of what these individuals dealt with that affected them rather physically and mentally and emotionally. And what they determined was there were some issues that came about in childhood that thereby affected them in a way that their mental health and physical health was compromised. So as I mentioned before, things like having an individual in the home, a parent or a caregiver in the home who has a mental health condition or a substance use condition, or having a loved one who might be incarcerated, or having someone in the home who is, there might be a domestic violence situation, any number of those different kinds of things. They came up with 9 questions or statements. And so basically, the more of these that you answer yes to, the higher your ACEs score. And of course, what we determine is when a person has a very high ACEs score, they are more likely to develop either physical or mental health conditions later in life. So as you see with trauma-informed care, really what we're doing is we're trying to create a way to have an environment where the individual feels safe. They have a choice in their treatment. They collaborate with the clinician. And there's a sense of trust with the individual and the therapist and the organization. And the person's empowered to create the life that they want and do what they feel they want to do. Really, in other words, it really puts the emphasis on the client or the patient and what they see they want as the outcomes. And the last piece there is cultural sensitivity, which really has kind of been added on in the last several years, because we realize that different groups have different concerns and different needs. So when it comes to cultural sensitivity, we do want to recognize differences in beliefs and traditions and culture, whether it be African-American culture or Latino culture or indigenous culture. So there's different cultures within our country that when you look at trauma-informed care, that in itself is a little bit different. So we do take cultural sensitivity into account. And then real briefly, there are a lot of medications, of course, that are used for mental health. Now, let me just say this too, and I can speak once again from personal experience. I've been taking medication literally since 1981 when I had my first episode. So what I would have to say is this. In my, once again, my personal and actually my professional opinion is, if a person is dealing with a mental condition, whether it be like depression or anxiety, something that they're facing, maybe especially for the first time, and they're having a hard time with it, certainly many times they'll go to their doctor, and the doctor I'm talking about the primary doctor, and the doctor may many times want to prescribe an antidepressant. But my thinking is also that they might want to explore more of a different approach, maybe go towards maybe talk therapies. And there's also a lot of self-help tools that people can use to help themselves when they're dealing with mental health concerns. So medication is many times necessary, but isn't the only thing that people use. In other words, when medication is used, it should be used many times with I believe, a form of talk therapy, because the medication is just one of the ways a person can remain well. I personally not only use medication, I have therapy. I still attend my 12-step program. I exercise. I meditate. I do a lot of things for my emotional well-being. But then again, the medication piece is just one part. So as you see here, there's a number of different types of medications, antidepressants, antipsychotics, anxiolytics that treat all types of conditions as you see here. So the thing when it comes to medications is that, of course, there may be side effects. And that's one thing that people really struggle with when it comes to medication. They feel that, well, I don't want to take this because it makes me feel this way, or I gain weight, or I feel sluggish, or I feel zoned out. Sometimes it takes time for medication to take effect and for a person to adjust, or it may not be the right medication. It might take trying something else. So there's a lot of things that are still, we're learning about medication, how it works, and approaches. And like I said, that it's not the only way. There's some people that feel that they don't need medication regardless, even despite having conditions like schizophrenia or bipolar disorder. There are individuals who choose to live with these conditions and manage their illnesses in holistic ways, which is another approach to dealing with mental illness. And then we have depressants, mood stabilizers, and stimulants. I take a mood stabilizer for my bipolar disorder, as well as an antipsychotic medication. And I've been doing that for, like I said, a very long time. But what I've discovered myself is I found what works for me. And it's been my experience that it allowed me to live my life and be productive and to work and to do a lot of things that personally, I believe if I didn't get the help of medication, I may not be able to do that. Now, if things were as they are today, 40 or so years ago, when I first was diagnosed, maybe I would approach it differently. But back then, there weren't a lot of the choices that we have today then. Of course, that was a long time ago. So now I think we have a lot more opportunities to do things. And of course, we're going to go into the future of mental health in just a second, of what's available. But what I'm saying is that medication is one way, but we're learning new things as well. So the future of mental health. In my research for this program, I came across an article that talked about even blood tests for mental health. Now that's really something that is very unique, considering it's been for the longest time, they've said, well, you can't test for mental health conditions. Well, guess what? They're working on that right now. They're trying to come up with blood tests to determine if there's anything that could be markers for a mental illness or a mental health condition. There's been a lot of research when it comes to psychedelics and mental health. One of the things that has held up psychedelic research is essentially this, the drug laws and basically how drugs are categorized in our country, and in terms of what can be used and what can't be used. But now these things are being studied in controlled environments in a way that individuals are screened, they're evaluated before they try these medications to make sure they're safe. One thing I've learned, and I do know for a fact, is that you see here psilocybin, MDMA, LSD, and ketamine. These are really used a lot for people dealing with depression, anxiety. But when it comes to people with psychosis or have a history of psychosis, you would never prescribe something like this, because it'd certainly be something that could really trigger someone and make them very unstable. And then there's digital wellness, otherwise known as shutting off the screens. So we live in this world of smartphones and tablets and TVs and monitors. Digital wellness is all about setting up time away from our devices and being more strategic about how we use these devices. If you have a smartphone, which I'm guessing 99.9% of you in the audience do, you probably have a feature on your phone where you can even set it up where you can shut it down at a certain time, or shut down certain apps, or even control your social media. So we have all these tools now to help us essentially get away from these devices so they can be healthier mentally, emotionally. I'm sure many of you heard back, I think it was over a year ago, with the big whistleblower story about Facebook and Instagram, where young women were looking at Instagram and because of that, they were experiencing severe depression and other mental health issues simply by looking at others' posts and comparing themselves to others and body image and everything like that was affected because of this digital media that's out there. So it's like the double-edged sword. I mean, I think there's a lot to be said for social media and platforms, but then again, it can be very harmful for others as well. They're getting into things like artificial intelligence in clinical settings. So in other words, learning how to detect symptoms of anxiety and also can help clinicians evaluate their skills. So AI is even being used in behavioral health settings. Now, this is not meant to replace the work that clinicians do. It's just another tool. And so what it does is it kind of works with the clinician. And so there's ways it can observe a client or a patient and kind of pick up on these cues to determine if there's any anxiety that the person's experiencing. And of course, we have telehealth, which certainly because of the pandemic, which we are still in the middle of, and this presentation is another way to use our platforms. Telehealth has expanded, but it's continuing to expand. And now telehealth is very common. We have a lot of behavioral health providers that are doing things, nationally that were never done, I would say, even 3 years ago. I mean, we've had a boom and just all these different mental health platforms that now can be accessed online, which helps a great deal because there are a lot of people living across the country that don't have access because simply where they live. There are a lot of people that live in, say, rural areas that would have to travel at least an hour, if not more, to see a clinician. Whereas now with telehealth, they can simply do it from the comfort of their own home and really find ways to get help. There's all kinds of other things. We're going to talk about apps and so forth. So there's all kinds of ways that people can get help that weren't there before. And then transcranial magnetic stimulation is used for depression, bipolar disorder, ADHD, and OCD. It's really where something is, it's like basically hooked up to the person's head. It's like almost like a cap that goes on, and it provides this stimulation. And what it does is it just kind of activates the neural pathways, and it tries to work in a non-invasive way, you see here, to stimulate the brain. And then lastly, for chronic pain, even we have virtual reality. And so all these advents in mental health are happening that the world is changing as we speak. There's literally right now, I'm guessing at this moment, someone somewhere in a lab trying to find the next great cure. So if you recall at the beginning of the program, I talked about the 16th century. Well, where we're at right now is the 16th century of the 24th century or 25th century. So there are always things being developed and learned about. So, and that's the wonderful thing, is that we're able to fine tune and find better ways to help people and help them know that there are opportunities to get better, to learn, and to grow. I want to mention briefly something too that's really important that's going on in mental health now, and that's the peer movement. And here are a number of peer-based agencies that are across the country that are very, very big when it comes to peers. Now, peers are people who have lived experience with a mental health condition and or even addiction that are basically advocates, and they are essentially moving mental health care in a positive way. So NIAPRS is the New York Association of Psychiatric Rehabilitative Services here in New York State, and it's headed by Harvey Rosenthal, who is a phenomenal advocate. And so that's one of the peer organizations that's work on the policy level, as well as advocacy level, education, training, and so forth. Peers for Progress is another grassroots organization. BEAM is Black Emotional Mental Health Collective, based out of California. So they focus on mental health and well-being for communities of color. There's the Depression Bipolar Support Alliance, which is just what it says. It helps people with depression and bipolar disorder. And then Active Minds is a peer-based group that's on college campuses across the country. They have chapters that provide services for students, but they also have a speakers bureau that goes around, their speakers go around and talk to college campuses. So, and there are a lot of other peer-based organizations across the country that really empowers individuals to take control of their mental health and realize that they don't have to just be victims. They can be proponents, they can be empowered, like I said, and be the ones who can make a change. And I'll tell you something, when it comes to a lot of things that have happened in the world of mental health, especially the last, say, 30 years, a lot of it has been driven by the peers. There's a saying that says, nothing with us without us. And that is a peer statement right there. So peers are very important. Even where I work at the Mental Health Advocates West New York. I supervise a team of youth peer advocates. We also have a family support program that has family peer advocates. So my team of YPAs, as they're otherwise known as, work with young people and youth dealing with mental health conditions and so forth. They go into schools and they do presentations. And essentially, they're helping young people and children who are having even emerging issues. And one thing we know about mental health is the earlier the intervention, the better. So if you get to a young person early, you're going to help them. So there's a lot of great things going on in the peer movement. So when it comes to mental health, also the consideration is mentoring. So a way you can help someone is through mentoring. That's by, once again, empowering the person. There's modeling that you can provide, companionship and skill building. So when you mentor someone who is living with a mental health condition, you can help them with these things. There's an organization I used to work for here in Buffalo that has affiliates all over the country, Compeer. And Compeer is an organization that is a mentoring organization for people with mental health challenges. They match adults with other adults and youth and even veterans who are dealing with mental health challenges, and thereby give that person companionship, a friend, sometimes someone to spend time with, which can be incredibly valuable for that individual. And then when it comes to education, there's also things in the mental health world that can help someone who is, say, pursuing an education. And this is known as supported education. So this really is where essentially no one is excluded from this. In other words, individuals in the education world should be able to pursue an education despite whatever challenge they're facing. And certainly when it comes to education of all kinds, we know there's accommodations and things that are provided for individuals, certainly through the Americans with Disabilities Act. But these are the kind of things that people with mental health conditions certainly should be allowed to have. So we know also having specialized services, you can see here, individualized services, ongoing assistance. So this is needed to help an individual achieve their goals and get through the educational system, which certainly can be challenging enough as it is. But when you're having a mental health condition, say like anxiety, getting through college or any type of education program can be very challenging. So essentially, if you provide these services, it's really going to help someone a great deal. And then, of course, we have education specialists who work closely with school personnel and mental health practitioners. So when you have education specialists who work alongside educational programs, they focus on things like mental health to assist individuals when they're facing challenges, but also can achieve their goals. And of course, we have, as like I said before, preference when it comes to consumers or individuals' strengths, experiences. And think about the idea that when it comes to a person having their preferences, you want to make sure that they're making the decision. Of course, a lot of times in education, in fact, I worked in higher education myself for 12 years. Many times, whether it be through advisement, the person feels that they're kind of being pushed in a way that they may not want to go. So really, choice is really important when it comes to individuals in education, allowing them to make the decision for themselves. Even if it may not seem to be the right decision, it allows them to make that decision themselves. So recovery is the goal. So when it comes to supported education, they go hand in hand. When an individual is being successful educationally, it's going to support their recovery and make them feel more empowered and improve their self-esteem and give them the confidence that they're going to need to go forward and achieve even more. I'll tell you something. I've met so many people over the years in my field of mental health and addiction and recovery that I've seen people go on to get bachelor's degrees, associate degrees, and even PhDs. There's one gentleman I have to mention who I met through a 12-step program, who, when I met him, was basically living out of a bag. He was homeless. And he got involved with the 12-step program. He certainly stayed clean and worked hard. He got into college. He got his bachelor's degree. He ended up getting his master's degree in social work, and now has his PhD. And I think he's not even 30 years old. So that tells you the potential that people have when given the opportunity to learn and be accepted and provided assistance that I think we all deserve and should have. A lot of it comes down to just simple treating people with respect and dignity. Resilience is a thing that's interesting because we all are able to understand what that means, but being able to adapt to difficult life changing experiences. So one thing about resilience is that you can develop resilience, you can cultivate resilience, you can grow. And many times it comes through maybe adversity, but that is also how people can improve their skills and improve their knowledge and just get stronger. And once again, when it comes to people living with mental health conditions, a lot of times it comes down to stepping out of their comfort zone and taking risks. Personally speaking, that's been the story of my entire career, professional career, is taking risks along the way. I have learned over the long run of working for well over 30 years that I have to take risks to be able to go further and become really that professional that I want to be. And so when it comes to individuals with mental health challenges, resilience is key. So the way we promote resilience is understand the way that individuals view and engage with the world. Also resources. There are a lot of resources available right now to help people in terms of resilience. Like I said, there's even self-help programs that can help a person develop resilience simply by being around others who have a similar challenge. And then to identify specific coping strategies. When you have a person live with anxiety and they are, say, struggling with, say, social situations, you help them to learn ways to cope so they can become stronger in those situations and find their own voice and be able to handle those situations more successfully. So there's ways to teach people coping strategies to help them promote resilience. And especially when you talk about young people, they just seem to be able to catch on to these things maybe a little bit more than even us folks who are older. So why does this matter? Why does all this matter that I've just been talking about? Well, 1 out of 5 people lives with a mental illness in any given year in our country. So we know that people who have more stress than ever, COVID-19, there's a lot of course, obviously the financial state of this country is in limbo with pending recession and prices rising all over the place. We have a huge social divide, that goes without saying, and climate change. So these are some major concerns that are increasing people's anxiety, it increases depression, and essentially is causing people a state of dis-ease, as we would call it. So we need to help people understand what they can do to improve their mental health. So what can you do? If you have someone that you come across who's struggling, listen. That's the most important you can think to do for them is to listen. Be empathetic. Try to put yourself in their situation and try to see the world through their eyes and what they're going through. Encourage them to seek professional help if they need it. Provide resources and also look for warning signs that there might be a mental health condition. I'm going to give you some resources in just a second where you can learn more about understanding how to identify warning signs and what to look for. So the resources are as follows. NAMI, National Alliance on Mental Illness, is an excellent resource for mental health. It's a grassroots organization. Mental Health First Aid is an 8-hour training program for individuals to learn about mental health conditions, raises awareness, reduces stigma, teaches a 5-step action plan on mental health. So mental health first aid is taught all over the country. If you go to mentalhealthfirstaid.org, you can find out where a training is near you. There's SAMHSA, Substance Abuse Mental Health Services Administration, and mentalhealth.gov. In addition, we have Mental Health America, which is mhanational.org, another national organization which provides help to people across the country. They have an anonymous mental health screening tool that's available that you can take. The National Suicide Prevention Lifeline, which is now 988. That number has just changed. So you can call 988 or text home to 741-741. Or for veterans, you see the numbers there. So the National Suicide Prevention Lifeline is an essential resource for people who might be at risk of taking their lives. The next 2 things there, BP Magazine or Esperanza, are 2 magazines that are available. BP is for bipolar, Esperanza is for anxiety and depression. I'm a writer for BP Magazine. I just actually am publishing my first article in January. I'm going to be a contributing writer for the magazine. And so I'm really excited about that opportunity. And the last thing you see there is my radio program, which just launched last Monday evening on the WBNY Buffalo radio station. And so that's the web address, and you can also hear it on Radio FX. Each week I'll have guests come in talking about their mental health, as well as the music that they listen to support their mental health. So essentially, all we've shared here is these different ways to understand mental health, maybe give you an idea of what mental health is, maybe help to understand really the fact that we're all dealing with, like I said in the beginning, we all are facing our own mental health challenges. So really the bottom line is, if you are in need of help, or if you know someone who's in need of help, or you have, say, students in your program who need help, help's available. You just have to ask for it. So with that, I'm going to stop sharing my screen, and we're going to see if there's any questions. I'm going to pull up the Q&A. So if anyone has any questions, or the audience, you want to ask anything, I'm available.